This is Mark Sullivan, who is the CEO of Catholic Health. He will begin his press conference momentarily. Just within the last 15 minutes, we heard from Debbie Hayes, who represents the CWA union. They said that their productive discussions over the last few days were productive, but unfortunately, she said it was too little, too late, and she said their members have had it. She said that they will be out on the picket line for as long as it takes. It all comes down to patient care and workers' conditions.
I'm Mark Sullivan,
and here is
CEO
Mark
of Catholic
Sullivan.
Health. Unfortunately, I'm here today to share the news you're already aware of. That is, this morning, the CWA 1133 made the decision to go on strike and take 2,000 of its workers from Mercy Hospital away from the patient's bedside into the street to picket. Catholic Health is a faith-based ministry. We've been servicing this community for over 170 years. This community here at Mercy and throughout Western New York. I'm here today to share with you our continued commitment during this strike to be here for our community in faith and in healing. This hospital in particular is an integral part of the community. It was founded based on a need right here in South Buffalo. We want to limit the disruptions to patient care. We want to ensure there's access to patient care during the strike. And we want this strike to be over. However, in preparation of today's events, we assembled a multidisciplinary team of nurses, caregivers, physicians, administrative staff to put together a contingency plan to be prepared for an event like today. And unfortunately, we've had to implement that plan. As a part of that plan, earlier in the week, with consultation with the New York State Department of Health, we've restricted services here at Mercy Hospital out of abundance of caution for the patients that we're servicing as I stand here today. That meant limiting services at Mercy in our EDs, our elective surgeries, as well as other services within the facility such as labor and delivery. I must take a moment and thank the community providers who have stepped up, ECMC and Kaleida, for being here to service the community during this uncertain temporary time. Let me talk a little bit about the workers that are here servicing and caring for the patients. Unfortunately, when we received the 10-day strike notice, the wheels had to go in motion to protect our community and the patients that are receiving care within Mercy Hospital today. With the notification early this morning, when the union left the bargaining table, they told us they were going on strike. We have activated the community response. That includes replacement workers that are certified professionals to come into the building and take care of our patients during the strike. It's important to note that my family and I would come to this hospital today during a strike if health care was needed, and of course in the future when our associates get back to work. Because Mercy Hospital is the hospital of the South Towns, and the workers that you're hearing outside are the soul of this hospital. They are the professionals that need to be back in the building caring for those in need. I want to talk a little bit about negotiations. We began negotiations in February of 2021 after the pandemic. We have been at the table relentlessly, day and night, to work with the union to understand where there was common ground. We learned about staffing, we learned about wages, we learned about supplies, and in every single instance, up until early in the morning, we responded, and I will share with you how we did. On Wednesday night, we put $31 million in wages and benefits on the table, which made Catholic Health's proposal to the union, CWA, fair and competitive market wages for all the hospitals represented by CWA. Secondly, unprecedented in this state and in this community, we put together a staffing plan. We know there's a national staffing crisis. We know there's a local staffing crisis. We know the governor early in the week announced a state of emergency related to healthcare shortages. Those shortages cannot be addressed overnight. However, in an unprecedented time, Catholic Health stepped forward and put together a proposal where we would add 10% more workforce over and above the average daily census, And we would also add between 150 and 230 new associates. And on top of that, we were committed to adding $20 million to the staffing plan, with a pathway forward that's unprecedented in this community and unprecedented in the state and probably in the nation. Despite our efforts into the wee hours of the morning, the CWA left the table. Unfortunately, we were getting close. We were waiting for proposals to come across the table based on our economic proposals we presented on Wednesday. We had good dialogue around recruitment, good dialogue around benefits, and we were at a good spot. We were 3 hours away from the strike, and we were almost there. We realize that our nurses, the caregivers you hear outside, are frustrated. They're tired. They are the heroes of healthcare. There's no contesting that. We need to do a better job working together with CWA, and they need to do a better job working together with us to bring this to resolution. This is the time that we need to be at the table. We invite the union back to the table to bring this deal to closure. There is no one that deserves that more than the associates that work in this building. There's no one that deserves that more than this community. And most importantly, there's no one that deserves that more than the patients that we are servicing for over 170 years. You have my unwavering commitment that we want to be at the table, we are at the table, and we want to get a deal done that's fair and equitable for the associates, with competitive wages, benefits, address the staffing challenges, and move on in the process of caring for the individuals throughout Western New York. So at this time, I'm not going to take any questions. I wanted to provide you with an update. We will continue to provide you an update. You know Joanne Kavanaugh. She's available if you have questions. She will take the questions from you. I want to get back to work and servicing the patients and working with the team here inside of Mercy. We appreciate your time this morning. And again, we remain steadfast and committed to the associates. We understand how they feel. We have wonderful proposals on the table that will increase wages, benefits, a path forward on staffing that is unprecedented in this community and probably in the state.
Sure.
So thank you for this time this morning.